Hello, this is Michael Good. I'm the CEO of University of Utah Health, and today is June 30th, and I present you with the COVID update for today, again, June 30th, 2020. As we've been tracking the last few weeks in our updates, at the national level, we've gone from approximately 32,000 new cases a day in the country at the beginning of the pandemic. We got down to as low as 22,000, but now in the last few days, hitting a new high of about 42,000 new cases of coronavirus infections diagnosed each day. And as you can clearly see, the trend is up. The same trend we've been watching on daily deaths continues downward. And so as we mentioned last week, this may be a time lag, or it may be changing characteristics of those being infected with coronavirus or other aspects of COVID-19 that we don't fully understand yet. But that second continued decline, a positive development as we watch trends in our country with coronavirus. We had this chart, it's from Johns Hopkins. It was reported on CNBC, but it shows you how states often in the East Coast who had the largest rise in new cases early in the pandemic are kind of have seen a decrease in their new caseload, while states often in the South and the West, which had smaller caseloads in the beginning of the pandemic, now seeing growing numbers in their state. And so one of the things about coronavirus is it does take on very regional, very geographic orientations. What's going on in one area can be quite a bit different from what's going on in another. Here in the state, we continue to see the rise of new cases of coronavirus infection introduced or diagnosed each day. For the last few days, kind of been running in this 400 to 600 window. But again, if you look back over the trend, certainly something we're keeping an eye on and trying to better understand how the virus is moving from individual to individual and what the nature of the infection that each person experiences, what are its characteristics. We've enhanced the active cases. This is a really important chart because it shows the number of active cases. And we've gone from around 1 in 1,000 to around 2 in 1,000. And we now are up over right at about 3 in 1,000 Utahns statewide experiencing a coronavirus infection. Similarly, the trend on this curve continues to go up, and we need to do things. We'll speak later about wearing masks, keeping distance from one another so that we don't allow the continued increase in the spread of this virus. So right now, about 3 out of 1,000 Utahns experiencing an active coronavirus infection. Similar trends on the statistics as before. We continue to see an increasing number of positive tests. This is since the beginning of the pandemic. I'll show you additional information about recent days and weeks. We continue to test, although not enough, and I participated in a number of conference calls this past week, both here at the University of Utah in our ARUP laboratories, as well as with state officials, looking at ways we can increase the number of tests that are available to Utahns for coronavirus. We've gone from number 5 in the country to number 19, and that is an important aspect of managing the pandemic. On very good news, the hospitalizations continue to decline, now down at 6.5% overall. A lot of analysis going into the decreasing need for hospitalization in taking care of patients with diagnosed with a coronavirus infection. Mortality remains low. It's one of the lowest in the country. And similar to past weeks, we continue to see over 40% of the deaths from coronavirus occurring in residents of long-term care facilities. Here we chart both the same case trends that I just showed you, new cases per day, again, between about 400 and 600 the last few days, but it shows the increasing demand on hospitalization. This is the total cumulative hospitalizations shown in orange, and then the new daily hospitalizations shown as a 7-day rolling average. And as you can see, now over 20 new hospitalizations a day, slowly over time, but certainly over time, increasing to now over 20, and as you'll see on some higher resolution charts, pushing 30 coronavirus new hospitalizations each day. This is the positive coronavirus tests per 1,000 tested individuals. And as you can see, as we chart the various restriction levels across the top, that the impact on positive tests of the different restrictions that were being put in place. And as you can see, pretty stable, this 4.5–5% positive testing rate that we saw through most of April and into May. And then in the yellow restriction level, and with more social activities happening, many times without masks, this is the positive rate for coronavirus tests. And you can see that in the last few days, it's actually been up over 10%, 100 positive tests for every 1,000 tests run. So clearly something we need to, through better masking, better separation, better cleansing, we need to get these trends turned around in the other direction. This is our real-time reproduction number, and it stayed in this. It shows you how potent a reproduction number is, because all of these increases that I've just shown you, going from 1 to 2 to 3 and 1,000, have happened with our reproduction number kind of hovering in this 1 to 1.5 range. And if RT gets up toward 2, you can really see even greater acceleration, greater increases than what we're seeing right now. We really need to get the RT, the real-time reproductive number, down below 1, so that we begin to see those case counts start to decline. Hospitalizations, as I mentioned, overall in the state now in the 25 to 30 range. So each day, another 25 or 30 Utahns need a hospital somewhere in the state. 12 to 18 of those individuals being hospitalized in Salt Lake County. So far, here at the University of Utah, we've actually seen a somewhat of a decline. We've been operating in this 20 to 30 COVID patients each day. Last few days, we actually saw a decline both in our census, and over the last few days, 1, 2, and 0 patients admitted on successive days. But there certainly have been days where 4, 5, or 6 patients have been admitted, and certainly the number of coronavirus patients in our hospital continues to increase, although so far at a rate we've been able to manage through a lot of skill and hard work from our nurses, our physicians, our respiratory therapists, our pharmacists, the whole care team. And it really does involve a whole care team when we take care of patients suffering from COVID-19. I'd like to spend a minute. A really important study was reported out last week. This is a collaborative effort, a true 1U effort between the Mariner S. Eccles Institute at the David Eccles School of Business and the University of Utah Health. you see the principal individuals involved in what has been referred to as Project HERO, or Health Outcomes, Health and Economic Recovery Outreach, or Utah HERO. We're grateful to the governor and the governor's Office of Management and Budget for providing the funding for us to do this really Herculean undertaking to better understand coronavirus in general for our nation and in specific for our state. Key aspects of the project during April and May, the HERO team contacted and went out and obtained both antibody and nasal swab viral tests for 6,500 Utahns located in Salt Lake County, Utah County, Summit County, and Davis County. 6,500, one of the largest such projects in the entire nation. Key findings: about 1% of that 6,500 tested, 1% had antibodies for coronavirus. So in the news, people talk a lot about immunity, those that experience coronavirus and then recover. But so far, certainly in the 4 counties where these tests were done, only 1% of Utahns testing positive. The percentage was a little bit higher in Summit County, a little bit lower in Utah County, but overall, a low number at 1% for those found to have antibodies to coronavirus. Another really interesting and important finding is that for every individual who knew they had had coronavirus, had a coronavirus infection, there were 2.4 other individuals who had the antibodies, meaning they had had a coronavirus infection, but were not aware of it. Either the symptoms were so minimal or potentially even no symptoms that caused them to seek a test, even though the antibodies show that their body has encountered the coronavirus. So as the epidemiologists help us state, a seroprevalence to case count ratio of 3.4, that's what they found. That means for every detected case, every individual who had a positive coronavirus test and knew they had coronavirus, there are approximately 2.4 undetected infections. And so this just shows you how powerful this virus is. It's moving through our communities, both in detected and undetected ways. What this also means is that the case fatality rate, so that's of the people who know they have coronavirus, as we mentioned, the fatality rate is 1, or as I reported just a few minutes ago, currently running 0.8%. But because the seroprevalence to case count is 3.4, again, meaning there's 2 for every person that has coronavirus, there's 2 that do not realize they've had it. The infection fatality rate is actually 0.3. So again, a virus that moves both detected and undetected through our community, but so far has a low and decreasing hospitalization rate and a low both case fatality rate and a low infection fatality rate. So as we've reviewed today, June 30th, some worrisome trends in the number of increasing cases, the number of active cases of coronavirus infection, and beginning to see our normal operating capacities in our hospital begin to be pressured, not in an alarming way, but we clearly need to reverse these trends. And I just re-show the graphic that I ended with last week. Really the best way for us to slow down the virus is if everyone wears masks, everywhere, and if you don't have to go outside, don't go outside. But we know that social activities are important. We know Economic and business activities are important. I feel that we can continue to do these if we get masks on everyone, and when it is not necessary to be close to one another, maintain the 6 feet. As always, wash your hands frequently and stay at home when you're sick. So that's our update for June 30th, 2020. We'll be back again next week with further updates as the coronavirus pandemic evolves at the University of Utah.